flexion, all right? So I need you to lay down, okay? Now looking at him, everybody knows what shoulder flexion is, right guys? Yeah, that's this one, all righty. Technically, can I do measurement or manual muscle testing in this position? Yeah, I could. But the fact is, if he lays down, he can stabilize his trunk better on the bed than me having to worry about stabilization. Because what if he really does do one of these? Leans back, leans forward, leans to the side. More work for me to do, all right? I want to do the least amount of work as possible. I don't need to be sweating during the whole thing, all right? So I'm going to ask him to lay down, okay? Supine. Oh, okay. Are you comfortable?
Yeah.
Technically, when we're doing this, they should be having their head, you know, without a pillow all propped up and all that. They should be. If they really want a pillow, I'm going to give them a pillow. All right? There's nothing about that. They want a pillow, they want a pillow. All right? Do you want your pillow?
Yeah, why not?
Yeah, you want your pillow. Where's your pillow?
It's up there, the blue one. I just put it in the pillow. In that bag, right
This
for
bag?
you. Yeah.
This?
Yeah, you can take
Okay.
that one.
All righty? Because you'll see in a minute what happens. Actually, yeah. Okay? You'll see that it does get in the way. But I'm never going to deny somebody a pillow, by the way. Right? Because they need to be comfortable. So, first thing that I'm going to do, alrighty, what you want to do is, you're going to ask him to, you know, can you bring your arm up and over your head? Okay? And he looks pretty good. Alrighty? He arches a little bit, but that's just his muscles moving. I'm stretching a little bit. Bring it back down. Now this time you do it, can you keep your thumb pointed up and do it? Okay? Alright, bring it up. Go, 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 go. Keep going. There you go. Very nice. And he has good motion. Right? And it actually didn't arch up, because more for the fact he was going much slower. Alrighty? And I had him turn his thumb upwards. Okay? Now, right? So I know he has, looking at it, it looked like 170-ish kind of range. Because this is considered 0 or neutral. Alrighty? And all the way up and over his head is 180, technically, okay? So he looked like he stopped at 170-ish, 160-ish, somewhere right around there. And that's what you want, right? So now we're gonna measure goniometry-wise, okay? And the landmarks that are you gonna use here is the greater tubercle of the humerus. Yes, it says greater tubercle of the humerus. That is your fulcrum. The proximal arm is gonna be lined up with the midline of the thorax or your trunk here, right? The distal arm is going to be lined up with the midline of the humerus using your epicondyle, okay? Epicondyle of the humerus, is very easy to find. Find your joint line again of the elbow, alrighty? Go above it. You feel a pointy little thing? That's it. You're right there, okay? That is the you got the lateral epicondyle, my index finger, right? Thumb, medial epicondyle, okay? Alright? Okay, so greater tubercle, a little bit more difficult to find, okay? Alright? Now, sometimes we can use the lateral aspect of the acromion as the fulcrum, because it's a bit easier to find, okay? Now to find you, everybody know the acromion, right? Alright, so what you're gonna do, alright, take your fingers, alright, you guys can do it yourself on yourselves in the other room right now, alrighty? You know what? Find your clavicle. Most people should find their clavicle very easily, it's not that hard, okay? If you can't, because you have a lot of muscle bulk there, round your shoulders forward a little bit, and it should pop right in, okay? You're gonna go lateral, all right, towards the shoulder joint, right? And if when you're following, it goes slightly posterior, okay? All right, slightly. Keep going, all right? As you're getting there, I keep following it, okay? You should be getting more to your acromion process. Acromion process is from what bone?
Scapula.
Scapula, okay? That's the flat thick anterior part of your scapula that goes over your glenohumeral joint, okay? And what you should feel there, it can be a totally flat roof, right? Or it can be tilted slightly backwards, right? It depends on the person. So if you're looking for it on your own, bring your hands or laterally from the midpoint of your clavicle, go slightly posterior. If you feel a flatness, but like a wider flatness than your clavicle, yes or no, right? You are on it, right? Now what you want to do is go to the lateral aspect of it, okay? Alrighty, and that is where you're gonna line up your fulcrum. Say it again?
It's boning. I don't know if it's this one.
It's
It's a little more
just like I
prominent.
said, a flat bone. You're gonna either have a flat roof or slightly pitched posterior roof. Alright, that's what's covering it, okay? Alright, go over your anatomy. Okay, I need my goniometer. Oh shoot. You know what? It's the other side so they get in the camera better, okay? Like your head the other way. Mhm. Okay.
You're going just past here, Tony? There's like a little indent, sort of?
Yes, we'll talk about
Yeah.
the indent when we get to the shoulder lecture, okay? Alrighty? Okay. Alright, so what I'm gonna do, alrighty? Alright, since it's your left arm now, keep your thumb pointed up, bring it up and over your head. Okay, good. Alrighty, what's in the way right now? The pillow. That's why we don't use pillows. But if they want a pillow, slide it over. Go ahead, lay down. Better? Okay. Bring it up and over your head. That's it. He probably has a little tightness along the way. So just looking at it, 160-ish, maybe 150-ish, somewhere right around there. Alrighty? Now, okay. Does the slope of his arm look like it's going into hyperextension?
Mm-hmm.
Yes, because it's nowhere near the midline of his trunk. So what are we gonna do then? Go ahead.
Hello?
Yeah, give him something to get him. Do you have anything else? You have your jacket?
I have another pillow.
Oh, you have another pillow.
Okay.
Wow. He has another pillow.
This one too.
Mm-hmm.
Oh, that's smart. Everyone brought like flat pillows.
Is there like a little picture?
Thank you.
You have a flat
Alright.
picture.
One, and then the other one's coffee.
Alright, I won't have him do the whole active again, so we can keep it going. Alrighty, I'm gonna keep it right here. Alrighty. Yeah. Sort of works out well. Scoop tells me just a drop. Alrighty, go ahead, right there. Okay. And down. Alrighty, so it's a little bit better. Alrighty, you want to try to get it as much as possible because depending on a person's muscle mass, they're gonna throw it off. I mean, if a person is very bulky up here, right? Looking at the muscle contours, right? And he's not so bulky down here, right? That's gonna naturally just drift the arms of the goniometer more into hyperextension. So we fix it by just propping him up a little bit, okay? Alrighty, so, alrighty. I'm gonna find the acromion process, alright? Right here. Alrighty, so I'm gonna use the lateral aspect. Alrighty, I'm gonna line it up with my fulcrum. Alrighty, and then I'm gonna line the distal arm with the midline of the humerus. Try very hard not to use the muscle mass, okay? It's the humerus alone, so you have to find his epicondyl. Give your elbow just a little. Okay, right here, okay, where my thumb is. Bring it back down. Alrighty, so I'm gonna line him up. I'm gonna pull the goniometer away from him right now. He's in a little hyperextension. I probably could prop him up a little bit better. okay? But I'm gonna leave it at that, because I know, because when you look at him, does he look like he's contracted or up in flexion when you're just looking at him? It's, no, he's not, so it's just the goniometer that's off a little bit because of the way he's positioned. That's fine. So I'm gonna, where'd your chromium go? Alright, there we go. Alrighty, so I'm gonna get ready. So what I want you to do, okay, I want you to lift it up. He's starting at 0, okay? I'm gonna ask him to lift it up. You, like I said, you can follow him along the way. If it's difficult to follow him along the way, don't follow him. I'm gonna take the goniometer away a little bit so I can keep in track, okay? Are you ready? On the count of 3, bring it up. 1, 2, 3. Go, go, go. Now, I'm gonna have to sort of picture where his chromium process is at this point. Alright, I'm trying very hard not, can somebody grab his pillow? Alright, so it doesn't, you can take it away now. Alright, so I can line everything back up. Alright. Okay. Alright, right there. I'm gonna pull him away a little bit. Right, you can relax your arm, bring it back. Alrighty, he started at 0, and so he started at 0. Here's 90, 100, 110, 20, 30, 40, 150, 154. So he went from 0 to 154 actively. Okay? Alright, so that is, right, shoulder flexion actively. Now, I want to assess his motion passively now, alright? I'm still going to stick with supine because, hey, he's there, alright? And also, less work for me about stabilizing if I absolutely need to move him, okay? So, with the position, alright, for him in supine, drop it in my hand, alright? How do we know?
He's relaxed.
He's relaxed, it's heavy, okay? And it's getting heavy. Right? Usually what happens, they may be relaxed initially because, you know, they're resting in me. Soon as I start moving it, what do people tend to do?
Tense up.
They try to help. Try not to help. Alrighty, so I'm gonna be here, alrighty, and I'm just gonna lift him up and go the other way. Now there are times, depending on the extremity, I may need to switch hand placement. So if I'm gonna be like this, okay, I'm gonna use both hands, I may need to do this now. Switch the hand position. Give him a nice stretch, a little overpressure at the end, right? Just push him a little bit. And I felt tissues resisting me, okay? If the tissue is resisting you, that's a firm end feel. What did you feel?
Pain. Well,
Sorry.
not pain, but like, you know, like.
What did you feel?
They do it.
Yeah, hold on, just relax. Right, and bring it up, switch. Right, and I'm just gonna give him a nudge.
I feel like I have tight lats, which is not flexion, and I feel like my back sometimes can rise.
Yeah,
That.
and that's because soft tissue is getting in the way. So that's a firm end feel. Remember in the beginning I said, pretty much the end fields, I would say 90% of the body is firm. The other 10% is either soft or hard, okay? Usually somewhere in that combination. It's either muscle resistance that's making it firm, connective tissue that's making it firm, anything like that, okay? It's making it a firm. Everything else, bone on bone, like elbow extension, hard end field, okay? All right, it's no matter how hard somebody's gonna push on my elbow extensors, it's not gonna go any further, right? Soft end field, elbow flexion or knee flexion, right? Or even hip flexion if they happen to have a large midsection, soft end field, all right? You feel mush, okay? Hey, so that was goniometry, shoulder flexion, okay? Passive range of motion, shoulder flexion. Since he's here, I'm gonna go to shoulder abduction before I flip him over, okay? Alrighty, so shoulder abduction, what's that one again? Somebody do that? Okay, very good, okay? Alright, so with your left hand, alright, Aman, can you just sort of bring it out to the side and up and over your head, okay? You can relax your elbow a little bit if you want, okay? Bring it up and over. Right? Again, you're using the anterior aspect of the acromion process now. Alright? Because where's my goniometer gonna need to be? You can bring it back down. It's gonna need to be on top so I can see where he's going. So you're gonna use the anterior aspect, right, of this acromion process, right? Proximal arm or stationary arm is gonna be lined up with the, I like to use the midline of the sternum or the midline of the anterior aspect of his thorax, alrighty? Lined up parallel, that's the proximal arm. His distal arm is gonna go down the midline of the humerus, right? And you're pretty much gonna have it, using your distal landmark in between the epicondyles of your humerus, okay? Alrighty? Again, a lot of eyeballing now, okay? You gotta really eyeball certain things. That's why I keep telling you, know your anatomy, okay? Eyeball it where it would be. And I'm gonna ask him either thumbs up, if he's comfortable, or palm up, one or the other. It doesn't really matter, okay? Whatever he's comfortable. Alrighty, so, you think I need a towel roll, yes or no? Do I care for this one? No, because he's going this way, alright, so I don't care. Alrighty, so even if it looks like it's sloping too much, it's not gonna affect the amount of motion. Alright, so, alrighty, alright. Sometimes you may need to turn their head, they may need to turn their head a little bit because it gets in the way, alright? So we already did it, and it looked like it got closer to 170-ish this time around, alrighty? So what's gonna end up happening, by the way? Am I in his way? Yeah, I'm majorly in his way. Nothing you can do about it, okay? Absolutely nothing. Alright, so I'm just gonna have to sort of back up a little bit. So this is one that you definitely can't really follow him along too much, okay? Alright, so you always wanna make sure what the front number is, okay? Alright, so I'm gonna find the lateral, anterior aspect of his acromion. So I'm gonna take his clavicle, follow it along, alright? Here it is. So I'm gonna have that imaginary spot right on the anterior aspect for his fulcrum, alrighty? Proximal arm or stationary arm is in line with the anterior aspect of his thorax. You could use his sternum if you want, alrighty? Draw your imaginary lines, okay? And you could see I definitely can't do this. By the way, when I do stuff like this, right, can it distort what I'm reading on the goniometer when I start molding it around them? Yeah, you can. So the only one that you really should not, the only one that you can mold is the ankle inversion even. That's the only one that you can mold. Alright, so I'm gonna keep it parallel. Alrighty, I already took that last measurement, so, and you know what? I know he starts at 180, okay, or 0. I'm gonna get my goniometer ready, keep everything in line. Alright, so on the count of 3, I want you to bring your arm out to the side and over your head. On the count of 3, ready? 1, 2, 3. Go, 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 keep everything in line. I'm gonna get out of his way as best as I can. Keep going, keep going, keep going, keep going. I'm gonna have to sort of picture where everything is, okay? Where his acromion process would be, alrighty? Line everything still parallel, alrighty? And everything in line with the humeral shaft. Okay, I'm gonna take it away slowly. Alrighty, and I get 160 degrees. Right? So he started at 0 and he went to 160. Okay? So you can see why I have them turn their head, because where was I? Right here. Right there. It can be a little bit nerve-wracking for some people. Okay? Alright? Oh, everything okay in that room? Can you guys hear me?
Yeah, we can hear you, we just can't see you.
Oh.
Because people are in front of the screen.
Oh,
Is there
okay.
any way of bringing this closer?
Yeah.
Because,
Yeah, we definitely get a little bit closer. No, you stay. We got you. Okay? Is that better?
Thank you.
Okay.
Thank you.
Alrighty. So,
That was palm up or thumb up?
either palm up or thumb up. Either one. Either one is fine, okay? I'm gonna let the patient decide that, okay?
It doesn't make a difference, considering
It-
like when you move it, it uses
As
different-
long as it's not, palm down. Right, as long as it's not palm down. It should be at least palm up or thumb up.
Okay.
Okay? Alright? Okay, so that is shoulder abduction, goniometry actively. Okay, if I wanted to do it passively now, alrighty, I'm gonna be in the way of the camera because there's not much I can do about that. Drop it. Okay, I'm gonna start him right here. Alrighty, and what I'm gonna do, I'm gonna just, I'm cradling it now because he has a long arm. It's gonna be difficult for me to switch arms back and forth all the time, so I'm just gonna cradle him because it's more for my comfort. Some people do tend to like to do it this way, okay? I don't, alright? What you wanna do is make sure, whatever you're doing, he's in a comfortable position and you're cradling everything, oh, and you can do the passive range of motion. So I'm just gonna get myself ready, and I'm just gonna bring his arm up.
My hand is
Okay.
Oh.
Whatever he's gonna do, okay? Alrighty, just relax, okay?
Even with my hand.
Just relax. Whatever position you wanna put it in, okay? Alrighty, so on the count of 3. 1, 2, 3, okay? Just gonna bring it up and over, alright? And back. Alrighty, now that's just regular passive range of motion now. Alrighty, if I'm gonna do a little over pressure, I'm gonna take him to the end range. Alrighty, and I'm just gonna give him a little nudge. Alright, and am I in some slight flexion right now, by the way? Yeah, not much I can do about it. Alright, because I can't, as long as I'm not up like this. Okay? Alright, so I'm just gonna bring him back and bring it up and out. Okay? Right, and a little over pressure.
What's the other way you said where you use 2 hands?
I just use 2 hands. That's just it.
Oh, that's it?
That's it. I just use 2 hands. I'm not comfortable that way.
Yeah.
Alrighty? When you do a lot of these techniques, okay, when you see it in the field, you're gonna notice I do it one particular way. Alright? Because I'm comfortable. I'm petite, alright? And a lot of my patients are taller than me and bigger than me. Alright? So I'm gonna use my own body mechanics to its advantage, okay? Because when I first started out in this field, it was 30-something years ago, I knew I needed to make my body mechanics last because I needed, do this till I retire kind of thing, alright? So you gotta make sure you're protecting yourself, right? That's what you're gonna be learning a lot about when you're doing the transfer techniques with Professor H, alright? The way she's taller than me, okay? If I'm transferring Krista, I may not need to bend that much. If she's transferring Krista, she's taller than me, she may need to adjust her body mechanics to her, right? So, yes, we're trying to teach you exactly how to do it, but everybody sort of needs to adjust it to their own body type, okay? Alright, so that is shoulder abduction, actively goniometry, passively, okay? Let's see, what else can we do? Why don't we do shoulder abduction? Because shoulder abduction is not there. Why don't we do it? Is it in the book? No, because it's pretty much there. There's never, very rarely have I ever seen, I think I might have seen it twice in my 30 years of doing this, where they had a shoulder abduction issue, okay? More for the fact because they had like a supported shoulder sling, and that's why they were out there. But pretty much, people will not lack in shoulder abduction, right? If we were gonna measure shoulder abduction goniometry-wise, right? Where would I start? Yeah, you start them abducted, and you just go back into abduction. Very rarely will you ever have to actually measure shoulder abduction, right? Very rarely. Can we even do cross abduction? It's not that easy to do because for him, he would have to go here, then here. We're gonna do something different though, okay? So, since we're in this position, can I go on to shoulder internal, external rotation? Okay, so, alright, scoot that way. Alright, keep your pillow. Alrighty, Remember, the rotational component, movements occur technically in the line of, gravity is sort of negated because it's occurring in the horizon. Alright? So, with this one, alright, can I wrap my goniometer anywhere around his shoulder joint? Yes or no?
Mm-mm.
And I bend it somewhat to get it around there.
No.
Not really. Same thing as the hip. Alright? So we're gonna use a distal landmark, alright, from the chromium process to measure shoulder internal and external rotation. Alright? So, and we're gonna use the electron process. Can't miss this one. Alright? It's this big bone right here. Okay, cannot miss it. Alrighty. So can you bring your shoulder up to 90 degrees of abduction for me? Okay? Are you comfortable? More or less? Yeah? Okay. Alrighty. What you want to see, alrighty, is his electron process more or less in line with his chromium process. Probably go up a little bit. Alright. So can you do this? Alright. For me? Oh, I just made it worse, I think. Hold on. I'm gonna take your, this is your pillow. I'm gonna take his pillow out, and I'm just gonna use the pillowcase. It's right over here, okay? So I'm just gonna wrap it up. Nice little roll. Okay. Okay. Somewhat better, alright? Because before when I used the pillow, it sort of elevated his shoulder a bit too much. Alrighty, so I didn't want that to happen. So I'm gonna have him line everything up. Okay, so I am gonna use the electron process as the fulcrum, okay? Alright, I'm gonna, proximal arm is gonna be either perpendicular to the ceiling. You can make it perpendicular to the floor if you happen to like the floor better, alright? Alright, moving arm is gonna be aligned with the lateral aspect of his forearm using your ulnar styloid process as the distal landmark, okay? Alrighty, so I'm gonna ask him, can you bring your palm down? Right, and I'm gonna watch what he does at the shoulder, making sure he doesn't, what may he do as he's doing this?
Internally rotate the shoulder.
Say it again?
Internally rotate the shoulder.
Say it in a different way. I know what you
Well,
mean.
yes, yeah, bring your shoulder off the table.
Yeah, he's gonna bring his shoulder off. He's gonna sort of round his shoulder too much, okay? Alright, that's the most common thing that he's gonna do. Patients will do. Alright, some of them may roll over to the opposite side. I've seen that happen. So you're gonna see what he does, and he did it okay. He did it okay. Alrighty, so bring it back up. Alrighty, some people may sort of try to adduct a little bit. Alright, like just adduct normally. Alright, so you want to watch out for that. Alright, so I'm gonna ask him. Alrighty. Alright, to bring it back up there. He brought it back up there. I'm gonna, yeah, I like the floor more for the fact it's pointing downwards. Just makes life easy for me. So I'm gonna line it with the electron process. Make sure, bring it up a teeny drop. Right, thank you, right there. Alrighty, so make it more in line. I'm gonna line everything up. So, everything is lined up with him. Fulcrum, electron process, the pointy elbow. Proximal arm, floor, perpendicular to the floor. Distal arm, going up the lateral aspect, medial aspect of the forearm with the ulnar styloid process as its landmark. So on the count of 3, he's starting at 0. I'm gonna ask him to bring his palm down, okay? So on the count of 3, 1, 2, 3, bring it down. Okay, keep, go as far as you can, that's it? Alrighty, I'm gonna pull it away. Relax your arm a little bit, okay? Alrighty, so he started at 0, alrighty? 0, 180, so he goes from 10, 20, 30, 40. So he went from 0 to 40 degrees of internal rotation. All
What's
right?
the normal range?
Normal is, go ahead.
0 to 70.
7, so he's a little limited. He's a little limited there, okay? All right, and what I'm gonna do now, all right, so I know actively it should be 70, and it's pretty far off. What am I gonna do?
Measure the other side.
Well, yeah, I'm always gonna
Oh, measure
document no
that.
matter what, okay? I would do it again,
Do it
all right, to confirm, all right? Maybe I read it wrong, okay? All right, so, bring it back up a smidge, right there, okay? Now line them up again. Alrighty. Okay, so it's still at 0, so on the count of 3, alrighty, bring it down, 1, 2, 3, go, 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 go. That's it? No more?
Mhm.
Okay, I'm gonna pull it away. Alrighty, so he went 10, 20, 30, 40, he went a little bit more, he went to 52, okay? Alrighty, because you always wanna ask them, is that all? Can you try to go a little bit more, right? What am I gonna be watching out for if he goes a little, if I'm asking him to go a little bit more?
Rolling his shoulder.
Yeah, rolling of the shoulder, see what he does, okay? And he didn't do that, so I'm okay. So for him, 0 to 52, okay? Alrighty, so that's internal rotation, alrighty? So if I'm, for external rotation, can you bring your arm back towards me now? Go, go, go. Okay, and I'm gonna watch. Try not to arch your back a little bit. Try not to, okay? Yeah, keep your knees bent. That will help. I bring it back. Okay? So I saw that. That's at least 90, almost 90. So I'm gonna line them up again.
Would you tell him not to like bring up his ribs?
Yeah, don't arch your back. Yeah,
Just don't arch the
yeah,
back?
don't,
Okay.
no. Try to keep it down there. And that's why I asked him to bend his knees up, because that sort of helps stabilizes him. Okay? Alrighty. So I'm gonna line them up again. Okay. Alrighty, so on the count of 3, bring your arm back down this way. Go this way, okay? On the count of 3, 1, 2, 3. Okay, good, good, good. Go, 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 go. Alrighty. Line him back up. Alright, bring it away. Alright. So he started at 0, he is
87.
85. He's at 85 degrees. Alrighty? So he is, the norm is 90. So he's fine. He's within normal range, okay? So if I wanted to write it separately, okay, for shoulder internal, external rotation, I could write it 0 to 52 for internal rotation, alright? For external rotation, 0 to 85, alright? If I wanted to write as one motion here, I would make sure left shoulder, internal, external rotation. Make sure you start with the appropriate one. 52, 0, 85. Does that make sense?
Yes.
Okay? Alright. For passive main motion now. Alright. Gonna get him to relax a little. Again, I like to cradle because you know what? I'm gonna use my own body mechanics as an advantage here for me. Alrighty? So I'm gonna keep him at 90 degrees of abduction, and you want to make sure he stays at 90 degrees of abduction. Alrighty, and I'm going to go this way, and then I get to his end range. I'm going to give him, okay, if I need to, I'm going to do this, stabilize him a little bit. Alrighty, stabilize him this way a little bit. Alright, to make sure he doesn't pop up. Alrighty, and I'm going to go in the other direction. Usually, typically, and I could definitely go more than 90 degrees here. Alrighty? Typically, if one has limitation in one direction, the other direction, typically, it's a little bit easier. Alright? I'm gonna go this way. Alright? At the end, I give him a little nudge, alright, to apply the overpressure. Alrighty? And I will feel a firm pressure. Firm end field. Okay? Alrighty? Alright? Now, he did, if you guys noticed, he rounded it up a little bit when I gave him at the end. Now, gotta keep an eye on him, okay? Sometimes I may need an extra person if I really want to stretch him out, okay? Questions? All right?
Where do you feel like where it's from? Like where your hand is or how?
what I feel, where I feel the resistance,
Where you feel the resistance.
right? Because end field of a joint means what you feel that's coming from the joint. It's not what you technically feel in your hands. It's what you feel coming from the joint itself, alrighty? Do you feel like you're hitting a bone against a bone, okay? Or do you feel soft tissue against soft tissue, alrighty? What do you feel like it's stopping you from the joint from going more? It's not what you feel in where you're stabilizing them and holding them, okay? Right, so that is internal and external rotation, okay, of the shoulder for actively and passively. Okay, so let's finish up external hyperextension. Can you go prone? Okay. Do you want a pillow for your abdomen? Or no? It's up to you. Okay. Okay? Again, some people tend to need that pillow support for their abdomen when they're in prone. If they do, okay. Okay? Sometimes when we get to the trunk at the end, sometimes it does get in the way. The fact is, if they want a pillow, they want a pillow. I'm never going to take it away from them. Okay? Now, for this, you can typically we would love it if we had a plinth with a hole for the head. We would love it, but we don't. Ask them to roll their head to the side. Nothing we can do about it. Okay? Alright? Roll your head that way. Okay?
Can I look that way?
No, I'd rather, it's better if you do it because it's going to strengthen. It's going to interfere with the test, so look that way.
If you look straight, if you put like a roll under his chin? Or?
Then it sort of hyperextends his
okay.
neck a little bit. Typically, we would love to have one of those lovely plinths with the holes. We would love that, but we don't. Okay? Actually, I think, no, I don't think the other mobile, high-low tables have it either. I don't think I've seen them. No, I'm not a fan of them.
No, you
No.
don't like the face pillows?
I don't like the face pillows. Alright? Because if you're not exactly right, fit for it, it just hyperextends everything. Yeah. So turn your head the other way. Alright. So again, I'm gonna for hyperextension, I'm gonna leave the pillow there because he wants the pillow. Okay? Alright, but it is gonna interfere with the test. And you're gonna take that into account. Okay? Alright, I'm not really sure how clean the floor is, by the way. Yeah. Alright? Alright, so I'm gonna line up my goniometer, same thing, hyperextension now. You are gonna use the acromion process, okay? It's a little bit more difficult to find now because he's prone, alright? So you're gonna sort of palpate for it, right there, and I'm gonna use the lateral aspect of it, alrighty? You're gonna use the proximal arm lined up with the midline of the thorax, okay? Distal arm lined up with the shaft of the humerus, alright? And you're gonna ask him, can you just sort of relax your elbow, okay? You don't have to lock it or anything like that, and you don't have to bend it all the way, just to keep it relaxed and lift your whole arm off the bed for me, please. Okay, on the count of 3. 1, 2, 3. Okay, alright? And I'm gonna say, try to relax your elbow a little bit if you can. If you can't, you can't, okay? Do it one more time for me. Right? On the count of 3. 1, 2, 3. Alright? And just eyeballing it. Alright? 20-ish, 30-ish degrees. Just regular eyeballing it right now. Alrighty? So I could see exactly how he does it. I tried to get him to relax his elbow a little bit, but he couldn't. I'm not gonna push it. Okay? Because I want to see what the motion is here. Alrighty, so I'm gonna line everything up again.
Does it matter how his hand is?
I leave his hand wherever it lands. Most people will turn it out with palm up, okay, because it's just more comfortable. Alright, so I'm gonna line her up again. Alright, other room, are you okay over there? You listening? Other room? Yeah, okay. Alright, they hear us. Alright, okay.
A little loud.
Yeah. Okay. Alright. This, actually, he's okay. He's not too. Alrighty. Is my goniometer in the way of the bed?
Yeah.
If this is where my acromion process is. Yeah, it is. So can you scooch a little bit more towards me? Okay. Good. Okay. I won't let you fall.
It
Is
goes
your
on the
arm
same
falling
wood
off?
video.
Move back. Okay, right there. So what I'm gonna do, again, use my imaginary lines here, alrighty? Where I'm gonna line them up and just pull it away. Because, yeah, it will get in the way, alright? It will get in the way, this bottom half. Nothing I can do about it. So I'm gonna line them up again, okay? Alrighty? He's starting at 0, right? So I'm gonna get my goniometer ready. So on the count of 3, can you bring your arm off the bed for me, please? 1, 2, 3. Go, 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 go. Keep everything in line. Check, make sure it's still in line with the fulcrum. Proximal arm is still good. I'm gonna pull it away. Alright? And he has 35. 0 to 35 degrees of hyperextension. Good? Alright, questions so far? Okay, so that is shoulder hyperextension. Passively, okay, so now, okay. Alright, I'm gonna be, alright, you guys, I'm gonna be standing right in the front of the camera when I do this, guys. Alright, I'm gonna keep my hand, one here, okay, and one by the shoulder. Alright, I'm gonna see if this is comfortable for me or not. I'm just gonna lift him up and back down. Alrighty, and definitely he was relaxed at this point because it was kind of heavy on me. I had to definitely use a little bit more power. Alright, I'm gonna stabilize him a little bit by the shoulder. I'm gonna lift it up. Alright, give him a little pressure. Alright, now if I notice that he is arching his trunk up a little bit, I will move my hand a little. Okay, but since he's not, I'm gonna keep it down here. I'm gonna bring it back up. Alright, give him a little overpressure. Alrighty, and then I'm gonna bring him back down. If I was just gonna do passive range of motion, okay, I'm just gonna go up and down a little bit. Just up and down. Alrighty, now, what's hitting the table? His hand. So, this cone position, when you're doing passive range of motion, is good for measuring, right, and getting the end feel. But if you want to do passive range of motion as a treatment, probably not the most optimal position. What position would be optimal, you guys think? Sideline, maybe sitting, okay? Maybe, depending on how you set up the table, okay? All right, so let's go on to manual muscle testing, okay? So can you sit up for me? All right, you okay? All right, I'm gonna leave my stool. All right, since he's on the plinth, I'm gonna keep him on the plinth. All right. All right, so if I'm gonna do manual muscle testing against gravity, all right, technically he has to go for, start at the beginning range, right? Depending on how he sits, right? Sit with the feet off the bed. All righty. Okay, put your hand here, right? No, right here, right? Technically, he's not really starting at the beginning in the range already because he's slightly flexed over here. So if I bring him to the edge, okay, right there, he's definitely starting at the beginning of the range. So be aware, okay, if they happen to have long arms, be aware where you're setting them up. Alright, you may need to get closer to the edge of the table. Or you may need to just put him on that thing, on a chair. Alright? So he can start with his arm lined up with the chunk. Okay? Alright, so I'm petite. I'm gonna stand on this a little bit. Safe. Alrighty. So, can you sort of bring your arm a little bit up and over your head? Thumbs up. Okay? When you do it, okay? So on the count of 3. 1, 2, 3. Go, 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 go. Alrighty. So he looks pretty good bringing it up, right? So I know he can bring it up against gravity. Put it down. Alrighty. Now what if he did, he did this, right? And he struggled to get it up to like 60-ish, right? What's that telling you already?
That he can't do against gravity.
He can't do it against gravity. So I would put him where?
Sideline.
Sideline. You would put him in a sideline thing. Pretty much same thing as hip flexion and hip extension, right? Get them in that sideline position. Alrighty, so, okay. I'm gonna show my leg is. So I'm gonna be up here. Okay, So this time, I need balance, okay, and I need my leverage to apply resistance. So if we were sitting in a chair, I probably could just stand a little bit off to the side, right, and posterior to him, right? Since I have him, he's sitting right here right now, I need to use my leverage, so I'm putting my leg up here to keep myself balanced, right? But the good thing about this right now, I can also adjust my leg just in case, as I'm applying resistance, he may like to do this, right? Some people like to do this, right? Some like to do that, right? So I'm still at the position of readiness to make sure don't do that kind of thing, right? So I'm here, right? I'm gonna use my hand to sort of help stabilize also, and at the same time, I'm not palpating the whole muscle belly, but my hands is able to palpate what muscle you think?
Anterior deltoid.
Anterior deltoid, which is right here, alrighty. And what other muscle? Your, not pec minor. Coracobrachialis, okay, your coracobrachialis, okay? So on the count of 3, I'm gonna do the same thing. Yes, his biceps do play a role in it, in shoulder flexion. So I'm gonna try as best as I can not to impede the biceps either, okay? I'm gonna be like right distal part, okay? Like right over here as he's doing it, right? I don't wanna be down here, because then he's gonna lock out into extension and he's gonna bring in every other muscle possible in that left upper extremity of his. So I'm gonna be here. So on the count of 3, I want you to do the same motion. I want you to, whatever pressure you give me, I'm gonna give right back to you. So on the count of 3, 1, 2, 3, go, 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 okay, 1, ooh, he's strong, okay, go, go, alright? And I would try to at least try to get him up to 90 degrees, okay, with the resistance. Because after you pass 90 degrees, are you 100% still going against gravity? No, you're not going against gravity anymore, alright? So usually at 90, I will stop pretty much at 90 degrees, and usually by then you definitely assess them for 3 seconds or so. So that will be okay. Right? Questions?
I have a question for the passive range of motion.
Mm-hmm.
So we're interested in the feel of the glenohumeral.
Yeah, what you feel there for the end field.
So, if, is it possible or even useful to maybe stabilize the scapula or stabilize at the level of the clavicle? So
Well, that's why I have him in a prone position, and either the supine position. Okay? So that the stabilization is taken care of. If I was here doing it, yes, I would have to stabilize totally different.
let's say
Okay.
that we're feeling for passive range of motion in abduction.
Mm-hmm.
And would it be possible to stabilize at the clavicle so that to prevent shoulder elevation if they're
What would get elevated? Only if they're elevated, okay? It really depends on what the patient does, okay?
you wouldn't hold it preventively to just to kind of
Not
feel?
necessarily. I would have to see what he does, okay? I would have to see what he does. Okay, so for shoulder abduction, okay, definitely you want him over here at the side, you want whatever side of the table. So what I want you to do, can you bring your arm out to the side here, okay? Alrighty, turn your thumb that way for me, please, okay? Now, can you, he has his thumb pointing to the side, right? Can you bring your arm up and overhead? Keep looking forward though, okay? Alright, stand up straight. Let me sit up straight. Okay. On the count of 3. 1, 2, 3. Bring it up. Go ahead. And go, 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 go. Definitely against gravity. He can lift it up. Alrighty, bring it back down. I'm also looking for, if he, commonly they like to do a lateral bend to the opposite side. He didn't really do it, so I'm not worried about that. And if he did, what would I tell him to do? Don't do that. Keep him straight, okay? So again, this is why. Ask him, see what he does the first time around, alright? Look at how they're either performing the motion or compensating for the motion, right? So he did good. Now, get back on my stool and be up here, alright? What muscle does abduction? Call it something different.
Medial.
Medial deltoid. right, and his supraspinatus. So I'm gonna make sure if I want to palpate for the muscles. And by the way, what does your deltoid insert on? What area of the humerus? Your deltoid tuberosity. Right? Kind of easy to find if they have a muscular deltoid. You just look for the point, and you palpate slowly inward. Right? And what you will feel is a little baby bump. Okay? Right? When they have a nice a muscular deltoid, it's kind of easy to find. Right? You just look where the point is. Right? When they don't, right? The upper 1/3 of the humerus, where it will be. Okay? Alright, so I'm gonna be right above the elbow. He's gonna do the motion, look ahead. Okay? Look ahead. Alrighty, so on the count of 3, I'm having my hands here to palpate for the muscles, okay? And stabilize as necessary, because I'm gonna, again, my whole upper arm and my trunk is ready to help stabilize if necessary, because I am applying resistance at this point. So on the count of 3, you're gonna do the same motion. Bring your hand up and out to the side and up over your head. Right? Whatever movement you give me, resistance you give me, I'm gonna give it right back to you. Okay? So on the count of 3, 1, 2, 3, go, 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 go. And again, after 90 degrees, is he going against gravity? No, so I'm gonna stop the retest at 90 degrees or so. Right? I'm not getting my goniometer out at that point to measure or anything like that, but you can definitely eyeball it. So that is shoulder abduction against gravity. Okay? Questions?
Can you mention that again? You said that where it forms, where it
Yeah, where
starts?
that nice little point is.
Okay.
That is gonna be where his deltoid tuberosity is. That nice little point.
So you feel like a little bump.
You feel like a little bump, little bony bump. Okay? That is where it is. Okay, remember, it's deeper. Okay, because what does he have covering it?
Muscle.
Muscle. So you're gonna have to slowly palpate deeper in. Okay? I'll go over your bony anatomy. Have you guys logged on to the kinesiology online stuff?
I have a little skeleton.
Yeah, okay, because it really does help, because it gives you that whole 3D view of everything, okay? Alright, so before we move on, now let me do gravity eliminated, okay? Oh, sorry, gravity minimized, okay? So what position would I put him for shoulder flexion?
Super.
Sorry.
Lower
Sideline, okay, whichever side you want. You know what? Head this way. Okay? Okay. Hey, so, you want your pillow? Yes, give him his pillow, because he really should not be supporting his own head. Okay? Okay, so, what you want to make sure, you want the other pillow too?
No, it's fine.
Okay. Alrighty, so what you want to do, again, head, neck, trunk, all in line. Alrighty, so I'm going to move. You know what, since he's right here, I'm going to do shoulder hyperextension first. Alrighty, so I'm right here, I'm right under him, I'm supporting the elbow and the humerus. I'm going to have my hand right here to stabilize, and also my trunk. Okay? Alright, so I'm going to just, drop your hand in me. Now, what I want you to do, okay, I may need to abduct a little bit so I can get my arm up there. That's okay. I want you to sort of bring your elbow back towards me. I'll get out of the way if I need to, okay? So slowly bring your elbow back towards me. On the count of 3, wait for me. Okay? 1, 2, 3. I'm just gonna have him do it. Remember, this is manual muscle testing now. It's not passive range of motion, so he should be doing it. Okay? And what muscles will I be palpating for hyperextension? Latissimus dorsi. Right? Now he's strong. I don't feel a lot of it because he's strong. Right? But when we're palpating for it, you could be right in the posterior aspect of the axillary fold. Right? You will be able to feel the muscles coming into play. Also, what other muscle?
Teres major.
Teres major, okay, that's coming into play. Alrighty, now if you want to sort of distinguish between them, your latissimus dorsi will be in the axillary fold, okay? Now for him, since I'm doing gravity eliminated right now, probably can't really feel much because he doesn't need that much muscle force coming out, alrighty? But if I was gonna resist him going into hyperextension, whether it be against gravity or gravity minimized, yeah, I'll probably be able to get the muscle fibers to come out. Does that sort of that makes sense, right? Right, because he doesn't need to recruit a lot of muscle fibers, okay? So, to do, drop it, all right, okay? And I let his elbow relax as much as you can. I'm gonna stabilize him with my trunk in my hand, and on the count of 3, bring it back towards me. 1, 2, 3, and there he goes. And what may he do to compensate? He'd lean his trunk, so that's why I am here. And I will say, hey, don't lean back so much, okay? So that's shoulder hyperextension, right? Okay, I'm gonna come around this way, right? Come closer to me this way now. Okay, just the opposite. I'm gonna be in the front, watch him here, stabilize him, cradle, alrighty? Start him in neutral position. So on the count of 3, bring it out towards me. 1, 2, 3. I'm just gonna go with him. I'm gonna get out of the way. And he's going all the way up. I'm just gonna walk around, all right? So you always wanna be strong tendency. Sort of walk before he actually moves. Don't do that, okay? It's hard to do. You should let him lead you, all right? So think of it as,
Like I'm pushing you.
yeah, he's pushing me when he's doing shoulder flexion, or he's pulling me when he's doing going back into shoulder extension. Alright, so we'll do it one more time. So on the count of 3, 1, 2, 3, and he's just gonna push me out of the way. Alright, now if I'm gonna go back into shoulder extension neutral now, he's gonna bring it back on the count of 3, 1, 2, 3, and he's just gonna lead me. And I'm gonna try very hard not to push him along. Okay? So that is shoulder flexion extension, gravity minimize. What position would it be for abduction? Supine. Okay, so can you go supine for me? Alright, we'll do this side, okay? Alright, so what I'm gonna have him do, I'm gonna have my hand, okay? Cradle him again, okay, because it's comfortable for me. Alrighty, if the extremity is really heavy for you, you need both hands. Okay, use both hands. Alrighty, but I find it more comfortable cradling. I'm gonna have like one hand under my palm under the elbow. Alright, my fingers are supporting his humerus. My forearm is supporting his forearm. So on the count of 3, I want you to bring your arm up, out to the side and up, okay? 1, 2, 3. And I'm just gonna follow him along as he's pushing me, okay? And then back, if we're gonna test shoulder abduction. Does that make sense? Okay? Are we good? Okay, so, last 2. We'll do the horizontal stuff on next Wednesday. Remember, there's no class on Monday because of the holiday. Okay? Everybody don't come here on Monday.
Holidays.
I think
Yom
it's
Kippur.
Yom Kippur. Okay, actually I kind of need you to go PROM.
Like face on the side.
Yeah, face on this side, so, because the camera's this way. Okay. Alright, here, you want your pillow? Yeah. Okay. Alrighty, so, for hyperextension, we didn't do that one, right? Against gravity?
This one works.
Yeah, that one. For against gravity, manual muscle testing, did we do that one?
No, they're
Right.
goniometry.
Okay, alrighty. Okay, so technically, turn your head so it'll be comfortable. Because can you guys see this? Actually, do what you were doing before. Can you see how hyperextended he is right now?
Yeah.
Yeah. That's not really comfortable after a while. So turn your head a little bit less. Okay? A little bit less. Mm-hmm. Okay. Alright. So he is definitely, because you're looking at the muscles contracting and the movement and all that, you want the spine as neutral as possible when you're looking at the shoulder. So, you know, if they're in like a fixed kyphotic state or lordotic state, you know, they're fixed. There's nothing we can do about it, right? He was just in a position. okay, where he was hyperextending everything, okay? So that you can do, okay? So, for shoulder hyperextension, what muscles are involved again? Okay, latissimus Miss Dorsey and Terry's major, alrighty? So, so to sort of move things along already, we already asked them to do it actively, okay? So what I'm gonna do, alrighty, when they tend to apply resistance, when you need to apply resistance, what may they try to do to compensate? Right? They may try to arch their back, turn over that way. So my arm, that's not applying the resistance, is gonna be here, just placed here. And that's gonna hopefully just tell them, don't do that, okay? So if it does, my arm is at the readiness to sort of tell him, you know, resist him a little bit when he's trying to compensate. Alrighty? Now, right? So before I do that, I wanna make sure he's using the appropriate muscles. Can you just sort of bring your elbow up to the ceiling for me, please? Right? And you can feel his latissimus Miss Dorsey coming right up into play here. Okay? Alrighty, bring it down. Now this time, we're gonna do it. I'm gonna apply a little resistance. Whatever you give me, I'm gonna give back to you, okay? Alright, I'm gonna apply the resistance below, below the shoulder joint, but right above the elbow. Alrighty, I'm gonna stabilize him a little bit. Alright, so on the count of 3, bring it up again. 1, 2, 3, go, 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 go. And relax, and I can feel his triceps, latissimus Miss Dorsey coming into play. Alrighty, and relax. Alright, so that is shoulder hyperextension. Okay? Yes or no? Alright, so, the last one, internal and external rotation. Okay? So, can you do, no, stay right there. Alright, scooch over towards your left.
To the edge.
Just before the edge, I don't want you to fall. Okay? Now, can you bring your elbow, it's not your elbow, your arm up to 90 degrees of abduction? Very good. Alright, bend your elbow. Very good. Now, relax it. Drop it down. Good. Do you have enough room to scooch over or no? Alright? Because you do want his whole humerus supported. Alrighty? Alright, so what I'm gonna ask him to do, alright? Now, by the way, why am I doing manual muscle testing of the internal rotators and external rotators in a prone position?
Against gravity?
Scapular muscles?
Oh yeah, it's the most against gravity, alrighty? But what else?
You're testing the muscles of the scapula?
Yeah, the muscles are where the location of the muscles are, right? Thorax is still being stabilized by the plinth and all that, but I have definitely easier access to the muscles, okay? So I can palpate for everything. So if I am gonna do external rotation, right, manual muscle test, what would I tell him to do? Picture him prone. Which direction would I tell him to bring his arm up towards?
External rotation?
External rotation. Very good. Okay, so what would you tell him to do? Use your words.
Your arm up towards the ceiling?
Yeah, bring the top of your arm up towards the ceiling. That's all. Okay? And I would see what he does. Now, if this gets in the way, just scoot him out a little bit. Okay? That's all you have to do. Just scoot towards me 1/2 inch. That's good, right there. So keep his arm back here. Alrighty? So if I want him to do internal rotation, what would I tell him to do?
Can you go the opposite way?
Okay, okay, what else? Okay, what if it's the first thing that he's doing? Yeah, bring your palm up towards the ceiling. So be careful with that. That's a good one, but be careful. Sometimes it doesn't always work, by the way. Alright, go the opposite way now. Alrighty? Alrighty? So that you can see how much movement he has. And again, what compensation. He did try to lift up a little bit, by the way. Did you notice?
No.
Yeah, he did try to lift up a little bit, not a lot. Alright? So we'll do external rotation first. And when I'm doing manual muscle testing for this, I need to be down here. Alright? Because it's just, yeah, this is better for me. Okay? So for external, because I have better leverage. Okay? There's external rotators, okay? teres minor right back down here so I could palpate and stabilize at the same time. Keep it like that, all right? Okay, all right. On the count of 3, I want you to bring the top part of your hand, the dorsum of your hand, up towards the ceiling. Try not to lift your arm off the bed. Just keep it on there, okay? All right. So if it does, you move your hand slightly over. Say, hey, don't do that. All right. So on the count of 3, you're gonna do that motion, and I'm gonna apply resistance mid proximal forearm area. Okay. So on the count of 3, 1, 2, 3, go, 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 go. Feel his teres minor coming into play for external rotation and back down, okay? And you're gonna watch. You try to get his upper traps to bring his shoulder up a little bit, all right? So I'm gonna say, hey, don't do that, okay? Try not to do that. Keep it in line with everything. One more time. Bring your top of the hand up towards the ceiling on the count of 3. 1, 2, 3. Go, 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 go. And there's definitely a lot less resistance now I'm applying, okay? All right, so for internal rotation, I would be in the opposite direction just to give myself a better biomechanical advantage. Alrighty, internal rotators are which ones? Your
Subscapularis.
subscapularis. You can't palpate for it, not the muscle fibers itself, but its tendinous junction going towards your humerus. You can't, okay? It's a little bit more difficult to palpate, and all right, but go back. You okay? Are you getting tired?
No.
Okay.
Just trying to resist.
All right. I'm gonna place my hand here. We already did the internal actively already, so I'm gonna apply resistance now. Yeah, proximal 1/3, okay, of the forearm. So on the count of 3, can you just bring the palm towards the ceiling for me, please? 1, 2, 3. Go, 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 go. And see, right? These fibers coming into play, and it's a little lax too, and relax. Actually, his internal rotators are a little bit stronger than his external rotators. Okay? Alright? So that is against gravity, internal, external rotation. Okay? Last one, because shoot, I gotta go. Alright, one more. Alright, slide towards me. Alrighty. Alrighty. Can you drop your arm completely off the bed? Like pointed, like fingers pointing down. Okay? Alright? Alrighty. Now, most people do not feel comfortable because where are they? They're on the edge, okay? So I'm definitely gonna be more in this position, alright, to make sure he's okay. Alright? He is gonna basically, because this is the most minimized position with gravity for internal and external rotation. So he's gonna naturally just point his thumb towards his head, direction of his head. So if I want him to do external rotation, what am I gonna tell him to do? This is the position that he's gonna be in, because I minimized it as much as I can, because it already was in a minimized position because of the motion that he's doing.
Turn his palm towards the wall.
Yeah, turn his palm towards the wall. Can you just sort of turn your thumb towards Krista for me, please? She's right there, alright? Good. External rotation. Okay. Alright, bring it back. Alright. Can you turn your thumb towards me behind you? Internal rotation. That's it. Okay?
Use your triceps.
Yeah, you have you tend to have a little bit more mobility of your internal rotators when you're in this position. Okay, I mean, it's fine. That's telling me it's muscular that's preventing it. Okay, it's more postural muscles preventing him from going into internal rotation. Right? So that is internal, external rotation, gravity eliminated. Okay, so I do need to go to my meeting. Okay, you guys can stay here and practice. I can't have all of you stay here in this room to practice. That's the thing, because we're exceeding the number.